Based on the findings that we've seen, and even if there are some differences in terms of the final data points, really the bottom line is that it doesn't change the recommendations with respect to the AstraZeneca vaccine in Canada at this point in time.
Canada's health regulators say AstraZeneca's COVID vaccine remains safe and effective at stopping severe COVID. This after American health officials say AstraZeneca provided outdated information in a statement about its vaccine's efficacy. The director of Health Canada's Medical Sciences branch says they're watching the situation closely, but say it would require seriously bad news for them to change their assessment.
Now, for the data from these studies to change the risk-benefit analysis for the vaccine, it would mean that the data would have to be very negative, which does not seem to be the case at this point.
The disputed data comes from an AstraZeneca press release on phase 3 clinical trials, but Dr. Supriya Sharma says the final data from those trials still isn't out. That still prompted this statement from the U.S. National Institute of Allergy and Infectious Diseases expressing concern over outdated information. Health Canada had been waiting for that same clinical trial data before approval, but after learning it would be delayed, Health Canada instead based its approval on real-world evidence from the United Kingdom, which was already vaccinating with AstraZeneca.
But I think it would be, in a way, alarmist to suggest that the results of additional clinical testing in the U.S. could lead to a change in the approval status for this AstraZeneca vaccine here in Canada.
Health Canada says it's monitoring the situation and expects to get full results from AstraZeneca soon. But health officials say these reports don't help with vaccine hesitancy. A poll this month from Angus Reid showed around 12% of people polled wouldn't get a vaccine if available. Dr. Sharma says Health Canada knows people's trust in vaccines can be shaken and is keeping that front of mind.
It's like any other reputation. Once potentially there's some doubt that creeps into that reputation, it's that much more difficult to gain that back. So I think, the press and the concerns around the AstraZeneca vaccine do not help. But what is really important is that we continue to put out accurate and reliable information.
There is one change to AstraZeneca in Canada. Dr. Sharma says Canada will soon follow the EU's lead in providing a warning label on AstraZeneca vials about possible blood clots. The European Medicines Agency says it hasn't found any evidence that AstraZeneca could cause blood clots, but couldn't rule it out either, and adds that it's now investigating if there are any risk factors that could link the two. In Ottawa, Xiaoli Li, City News.